Well, we knew it was coming. The CDC has authorized updated COVID-19 vaccines that will be available to all people ages 6 months and up. So it will target new widespread variants in the U.S. as cases and hospitalizations continue to rise. The decision came one day after the FDA approved the vaccines from both Pfizer and Moderna. So our Elaine Quijano spoke to the CDC director, Dr. Mandy Cohen, about the decision to include children in the recommendation.
In addition to being the head of the CDC, I'm also a mom and a wife, and I wouldn't recommend anything that I wouldn't recommend for my own family. So I intend to get vaccinated. My daughters, who are 9 and 11, are going to be vaccinated. My husband is going to get vaccinated.
How would you like people to think about COVID vaccinations moving forward?
I'd like them to think about it the same way they do their flu shot. I want folks to make it just part of keeping themselves healthy, making sure they have that protection and that shield. And use all the tools we possibly have.
All right, so Elaine Quijano is here joining us in Studio 57 to talk about this. So Elaine, I mean, usually when these boosters get rolled out, the focus is on maybe older people or more vulnerable people. This is the first time I'm hearing 6 months and older go get the booster. Why is that?
So it is pretty broad, right?
Yeah.
And the idea being that, look, kids can also have underlying health conditions, right? Sometimes detected, sometimes not detected. So that's number one. At the same time, if we're talking about protecting the community at large, we know that kids can carry the virus, right? And they may be asymptomatic, and they could potentially spread that virus to people who are more vulnerable, right? Those populations that we always talk about, the immunocompromised, the elderly, pregnant women. So there are a host of reasons in their minds to have that recommendation stand. Now, that being said, I also asked the CDC director, Dr. Cohen, well, who should get the vaccine first, right? Who should be first in line? And it goes back to those compromised sort of populations, those vulnerable populations, because of all of the reasons, you know, that we have learned over the course of the pandemic. When you look at who's in the hospital right now, who continues to be most vulnerable, those are the folks that should be first in line, Dr. Cohen said, to get the shot.
Yeah, it's hard to figure out just how to approach this kind of new wave of COVID, right? Because, I mean, there's so many people, I don't know about you, but there's so many people that I know that never got COVID over the past couple of years, and then they're getting it now. We're seeing the cases tick up. We're seeing hospitalizations tick up. I mean, how are officials approaching this?
Yeah, it's a good question because we are hearing about cases rising, right? I asked Dr. Cohen, well, how concerned are you about that? You know, the answer is it's not certainly when you look at the past levels that we were at of hospitalizations and deaths. We're not near that. So it's not alarming in that sense. At the same time, you heard a little bit there, Dr. Cohen and other public health officials are trying to shift the way the public thinks about these shots, right? That in fact, they don't like the use of the word booster. They want us to think about them as updated vaccines a la an updated flu vaccine, right? At the same time, they also want to make very clear, this is not like the flu because people die, they know, they are at an increased risk, right? Certain populations of hospitalization and of severe illness and death in some cases as a result of a COVID-19 infection. So in that sense, right, it's sort of a delicate line. They want people to get that flu shot, get the COVID shot, think of it that way, but at the same time, take it seriously and shift that mindset so it's not such a divisive topic, right? But something that just becomes part and parcel of our yearly checkups.
Right. The flu shot isn't divisive. You just get it and you're good, right? But yeah, I think people have, there's booster exhaustion, so I can see why they would want to sort of not use that word anymore and try and reframe it.
Sure.
Elaine, thank you very much.
You're welcome.